Okay. So, that is something I would evaluate.
Correct.
And if she has a deficiency of vitamin B12, we need to start her on treatment for that. Now, vitamin B12 is something that is very commonly found in our food, in green leafy vegetables, in non-vegetarian items. So, they are more than adequate, but sometimes you have some problems in your stomach or some other places which cause a deficiency of that. So, a proper evaluation regarding what is causing the problem. I believe that vitamin D deficiency will rarely cause symptoms.
Okay.
It's like a lot of times patients come to me with some disc on MRI or some problem in the MRI. The thing is, we are not treating the MRI, we are treating the patient.
Absolutely.
That's more important.
Yeah. So, rather than treating the reports or treating the shadows, let's treat the patients, as the doctor has rightly said. Definitely, you should go for any further test to come to the conclusion and exactly what is wrong as far as numbness is concerned.
Yeah.
Definitely, I think, and things appears to be manageable.
Yeah.
That's most important. Doctor, let's go for the next question, please. Hello. Hello.
Hello, doctor.
Yeah.
Hello, doctor.
Vichar.
I'm
Listen. TV se awaaz kame kar.
I'm Nancy speaking.
Yeah, Nancy ma'am, please reduce the volume of your TV at home.
Yes.
Yeah.
Hello, doctor. I'm Nancy speaking.
Yeah.
I just wanted to regarding my knee. I've got a very severe pain in my knee for the last 2-3 years.
What is your age?
I'm 55 now.
Okay.
55.
Yeah. So one leg, both legs?
And I've been to different doctors, but I've been to different doctors, but they gave me
different medicine.
It's giving me side effects.
Okay.
So I stopped it totally.
Okay.
And I tried homeopathy, Ayurvedic, and everything, but nothing is of use.
Oh. No. What is your weight and what is your profession?
I'm a housewife, and my weight is 68.
Okay. So right now you are not taking any of the medicines because they are giving side effects, and those medicines which are you feel that you can be take safely, but they are not giving any effects. Correct? So there are no effects and there are no side effects also.
Yes,
Let's see what the expert has to say on this.
Yeah. Good evening, ma'am. See, from what you have told me, your weight seems to be very reasonable.
Correct.
So the thing is, I mean, at your age, at 55 probably, the commonest thing causing pain in the knee could be a degree of wear of the cartilage or arthritis. Okay.
Yeah.
Now, as I said previously, the medicines as such, if we talk about painkillers as such, they don't treat the problem inside the joint.
Absolutely.
They will give you pain relief as long as you are taking them, but as soon as you discontinue them, they will not give you relief, and that goes for the other medicines which we discussed previously.
Correct.
Now, the thing is, what can help you out? Probably losing a bit of weight. What is recommended is you lose 1 kg of weight a month, not losing 1 kg in a week. So, probably you can try that, although your weight is very reasonable for that age. Now, the other thing that can help her is, a bit of physiotherapy. That is something, what happens with physiotherapy is the muscles across the knee get trained, and the weight load transmission across the knee, gets more uniform. So, you get pain relief.
Yeah.
Other than that, there are some lifestyle modifications which she can do.
So definitely there is a ray of hope, and as because what she mentioned, she went to so many doctors. Again, I would like to say the same thing. Rather than going to too many doctors, you go to the best and expert doctor, and I think that doctor should solve your problem. Correct? Anything you would like to add?
Yeah. Other than that, I mean, she needs a evaluation how bad the arthritis is. If it's very bad, then the treatment will be different.
Correct. Doctor, I think we have got another question. Hello.
Hello. Yeah, doctor. Good evening.
Very good evening.
I'm calling from Nagwa.
Yeah.
I have a daughter who is 9 years old.
Yeah.
Sometimes what she does is, she walks with a hunch back, and while walking also, sometimes, her leg, she puts it crooked leg. Now, this has been diagnosed from, when she was young. We took her to a child specialist, but earlier it was when she was, I think, two years or something like that. Then she said, the doctor said, as she grows up, things will improve. But I find sometimes she walks like, the right leg is crossed, like, and while running also, sometimes she falls down.
Yeah. You got the question. Yeah, I think you can answer.
How old is she?
9 years.
9 years old. See, a lot of times children have gait problems, okay, like bored legs or what he has described right now. So many of these problems get resolved with age. Okay, so by the age of 14 years, generally all these problems get resolved. But having said that, there are some problems which need addressal. Okay, there are some problems with the muscular problems, muscular dystrophies, which need to be addressed from the earlier age. The mainstay of treatment in these people with spasm of the legs or some bored legs or something like that is with physiotherapy. Bored legs in children again can be caused by vitamin D deficiency. So that needs to be addressed. Okay, if there is she is putting her leg in the wrong way, or if she is putting her hand behind, or if there is a gait problem, the gait needs to be analyzed for actually what is the problem in that. So initial treatment for that is physiotherapy. If that does not work out, there are other procedures which we can try to balance out the group of muscles in the leg or in the hands as far as it is concerned.
Okay.
But as long as she is developing normally, her IQ is good, and because these are all indicators of any problem during the birth. Okay, so if she is studying in the appropriate standard for her age, if she is doing good at school, I don't think you need to worry.
Okay. But even then, as you mentioned, our posture thing has to be addressed properly and to be seen if there is any other underlying pathology.
Yes.
Yes. Hello. We are having.
Hello, Dotor.
Yeah.
हांव वास्कोसून कालिदास फडते उलयतां.
Kallas ba vichara.
माझी एज 47. ओके. म्हाका हिप जॉइंट रिप्लेसमेंटाक आयला. म्हाजो हिप जॉइंट. सो हांव आतां एक्सरसाइज करून करून दीस काडटा. न्ही म्हाका इतले दोतोराक विचारपाक जाय, सो म्हाजो एक हिप जॉइंट लेफ्ट हिप जॉइंट रिप्लेसमेंटाक आयला. अशेंच जर हांव फुडें कित्याक जाता इतले फुडें वता तितलो बरें, जशें डॉक्टरान सांगलां. आनी डॉक्टर म्हाका खूब जाण सांगता अशें फुडें जितले जाता तितले बरें. हांव एक्सरसाइज करून दीस काडटा. हय. म्हाका इतले दोतोरा कडसून जाय की आतां म्हाजो लेफ्ट हिप रिप्लेसमेंट रायट हिपाक प्रॉब्लेम जातले अशें कंटिन्यू समज हांव चलत रावलो एक्सरसाइज करून अशेंच कंटिन्युअस केले जाल्यार म्हणजे रायट हिपाक प्रॉब्लेम जावपाक शकता.
सध्या लेफ्टाक प्रॉब्लेम आसा.
हय, लेफ्टाक हिप रिप्लेसमेंटाक हिप रिप्लेसमेंट ऑलरेडी जाल्ला तो, आनी दोतोरान सांगला एक्सरसाइजीस कर.
करूंक
ना हिप रिप्लेसमेंट करून अजून हांव मातशें एक्सरसाइज करता, हांव मातशी केअर घेता. एक्सरसाइज करून मात त्रास जाता. नो प्रॉब्लेम.
व्हॉट इज युअर प्रोफेशन?
माझी बोट चलयता.
पण स्टँडिंग उरता खूप वेळ.
हय, स्टँडिंग उरता, बसचें पडटा. स्वेल बी आसता न्हू दर्या, बोट घेवन वता आसतना फिशींग बोटी आसता पळय ते भशेन स्वेल बी आसता ते बसांनी चलयता, केन्ना उबे रावन चलयता.
ऐका डॉक्टर प्रश्न विचारता तुमकां.
Good evening, mister. Can you tell me for what was the hip replacement done?
No, not done.
Not done.
Planned. He's taking means right now he's taking care, doing exercise and trying to delay it. His question is whether similar problem will occur on the right side, because he is saying that already left side has been diagnosed as having the problem and he has been advised by the doctor to go for the replacement surgery.
Can he say what problem he is having on the right side? There are a lot of
right side is दुखता आता.
ना राइट साइडीन काय दुखना फुडकेन कितें करता हांव वॉकिंग वता न्हू, हांव वॉकिंग बी वता न्हू, तेन्ना वॉकिंग वता मात राइट साइड मातसो दुखता वॉकिंग वयता आसतना.
Okay. Just slight pain when he is walking, when he is going for a walk in the morning.
Okay. Good evening, Mr. See, the thing is, any replacement surgery of any joint is one of the best procedures to give pain relief if done correctly and for the right indication. It has something that has a 100% success rate, I can say. There is nothing 100% in the world, but yes, 99.1% success rate. So it gives a very good pain relief, and the longevity is very good. Now what can be causing is hip pain. There are a lot of things that can cause a hip problem. Some things are present on both sides, some things are present only on one side. So osteoarthritis, which is rare in India of the hip, but it can present only on one side of the hip. But if we look at loss of blood supply to the hip joint, that frequently happens in people who are consuming a lot of alcohol or people who have been taken treatment for asthma because they have steroids and everything given to them. So they tend to develop, the blood supply of the hip gets lost. So the bones become weak there and they collapse. So that is one of the more common indications for hip replacement in India. So that problem happens on both sides. If we are talking about an infection for which he is getting the hip replacement done, that happens on one side. So it depends upon
what is the cause, and accordingly we have to go for the management. So we cannot say that it will all happen on the second side, and definitely once the cause is established, definitely things will be better for the patient as well as for the managing doctor.
Yes.
Okay. Okay, doctor, we are having very short time. I think we will take this as the last question. Hello.
हॅलो दोतोर, हांव भारती पै उलयताले.
भारती, विचार प्रश्न विचार.
करंजळेच्यान वळखता न्ही दोतोर?
विचार प्रश्न विचार.
दोतोर, म्हजी धोपरां जाली न्ही, 4 वर्सां जाली, दुखता खूब. म्हणून ताका लागून हांव ट्रिटमेंट घेतालें जीएमसीन. आनी तांणी म्हाका रिजॉयंट आनी राकल्ट्रॉल ते दिल्ले. पूण आतां ते कितले तेंप घेवपाचे, आनी चड घेतले जाल्यार रिजॉयंट लोक म्हणटा माल पडटा आनी कितें सारकें काय म्हणून.
भारतीबाई, ह्या प्रश्नाची जाप ऑलरेडी डॉक्टरांनी दिल्ली आसा. खरें ताणें सांगलां की अशा पद्दतीचे जे वखद आसा ताचो चड लॉंग टर्म बेनिफीट व्हडलो असो तांकां दिसून येवंक ना. अमेरिकेन तांच्यानी एक स्टडी केल्ली आनी दे आर नॉट रिकमेंडेड. आतां कितें थोड्यांक मातशें घेवन बरें दिसता आनी डॉक्टर म्हणटा घेवन बरें दिसता, आनी जर असो व्हडलोसो सायड इफेक्ट ना जाल्यार तुमच्यान घेवं येता, बट नॉट एडवोकेटेड पॉलिसी की दिस यू कंटिन्यू फॉर अ लायफ लॉंग किंवा कंटिन्यू फॉर सच अ ड्युरेशन ऑफ टायम. करेक्ट डॉक्टर?
Yes.
This is what you have said.
It is not recommended.
It is not recommended. आता घेऊन मग तात्पुरते बरे असता, आणि if you feel you are happy, there is no more this thing. Doctor, before we wind up, since I have got little time, I have got one question for you. Special about osteoporosis. Now the days are changing. Now, apart from giving calcium and vitamin D3 supplement, the days of giving injection zoledronic acid, correct?
Yeah.
Not mistaken.
Of course. Right.
Because I am not so much prepared to ask this question, but just it shot up in mind. Is it recommended? And if it is recommended, in which age group you would recommend this? Because it gives good result, according to some of the doctors. Because earlier this was not in the, so most of the doctors doesn't recommend because it was never in their prescribed format earlier at least. So, but now things are changing. How it should be looked at with a positive result, and how, what is the line when it should be given, or what should be our modality of accepting as well as giving both?
Yeah. So, as
in short, short time. Yeah.
See, if the bone density of the person is very low, say they have scores like T score is less than -4 or something, then we think about giving bisphosphonate injection or something like that. The advantage is you have to give it once a year. Okay, so you can give it in any age group. The only thing is the kidney function should be good. Okay,
your creatinine value is to be done within normal limit.
Yeah, and your GFR, that is glomerular filtration rate, that should be good. As long as that is fine, that it does not cause any problem. The only side effect which you can get is you can have a febrile reaction, you can have a fever for 1 or 2 days. But generally it's safe.
So my question in nutshell, that we can look ahead in coming times that this can be one of the management, because osteoporosis become day by day more common, maybe as because of the lifestyle and a lot of other factors. Yes. Doctor, I think you have done a very good justice to the topic. A lot of questions we got.
Yes.
Just we are winding up. You would like to say something in one statement, take home message from today's program, then you are free to address. Yes.
Yeah. See, first of all, I would like to thank everybody for calling in so large numbers. What I would like to say is, whatever problems you have in your joints, if you address them in proper way at an early stage, you can prevent further course of, degradation of the joints. So, earlier you treat your joint problems in a proper way, see an orthopedic surgeon, see what the exact problem is there in your joint, get it treated early.
Okay.
So that your joints have a longer life.
Correct. Stitch in time saves 9. I think this is the best message you have given. Thank you very much, Doctor, for sparing your precious time and giving a very good advice to all our listeners and viewers. दुसरे फावटी येता ते कार्यावळीन आमचे बरोबर आसतले डॉक्टर अमन प्रभू गांवकर, गोयचे नामनेचे, काळजाचे तसेच डायबिटीसचे तज्ञ डॉक्टर. तुमचे ह्या विशयाचे जे प्रश्न आसतले ते तुमच्यान तयार दवर येता. ह्या कार्यावळीन तुम्ही इतक्या आत्मीयतेन वांटो घेतलो, असोच वांटो घेयात. ही कार्यावळ पळयत रावात, कार्यावळीन वांटेकरी जायात, आणि जो मेसेज जे तुम्ही जे ज्ञान मेळटा ते सगळे कडेन तुम्ही फॉलो करात, आणि सगळ्यांक बरी भलायकी आवडताना ही आयची कार्यावळ सोंपयतना तुमकां सगळ्यांक काळजान सावन देव बरें करूं. नमस्कार.